Australia, I've got the results of your STI check. You're going to want to sit down for this. It's my job to know as much as I can about what all Australians are getting up to in the bedroom. Well, not all the details. I'm mostly concerned with what infections we're passing on to each other and what we can do to prevent this spread. I'm Dr. Skye McGregor. As an epidemiologist who focuses on national surveillance of sexually transmissible infections, or STIs, and bloodborne viruses, so things like chlamydia, gonorrhea, syphilis and HIV. Who better to bring you up to speed with Australia's STIs and what we can do about them in under 10 minutes than me? Firstly, you don't need to worry. There aren't epidemiologists like me lurking outside your bedroom window with a set of binoculars collecting data. We do get our information through what's called public health surveillance, though. The word surveillance often conjures fear and images of cameras tracking our every move. But when it comes to public health, surveillance is a word that should conjure feelings of community and understanding. Surveillance, like the type I do on Australia's sexual health, uses anonymous data from large numbers of people. Certain infections and diseases in Australia are notifiable. That is, when someone goes to a healthcare practitioner, gets an STI test and is diagnosed, some information is reported back to health departments. We call these cases that are tested, diagnosed and reported notifications. We don't focus on individuals, but rather population-level trends, and we use this information for good to inform strategies to improve community health. So Australia, let's have a look at STI trends in your population in recent years. Sexually transmissible infections in Australia have been on the rise for some time, even though in 2020 we saw a slight decrease during the COVID-19 pandemic. Despite a 16% decrease on 2019, chlamydia remained the most common STI in 2020, with over 90,000 notifications. In fact, an estimated almost 1 in 20 young people had chlamydia in 2020. It's important to note that in addition to notified cases, there are people in the community who don't get an STI test and therefore aren't diagnosed. So for the 1 in 20 young people with chlamydia, only 30% were actually tested and knew they had chlamydia. You can see how important STI testing is. Gonorrhea was the second most common STI, with more than 29,000 notifications in 2020. Infectious syphilis was less common, with around 5,000 cases, but it can cause significant negative health impacts and in general has increased considerably in recent years. So while the number of notifications of chlamydia, gonorrhea and syphilis decreased in 2020, it's really important to note that untreated, all these infections can lead to serious complications. So, why do we think STIs decreased in 2020 after years of increases? 1. Lockdowns meant people were socialising less and having less sex, particularly sex with casual partners. Presumably, this means less transmission of STIs. 2. Health service access changed. With the availability of telehealth and restrictions on accessing care showing any signs of COVID-19, this meant less people sought face-to-face care, and we know testing declined. In 2020, the number of people getting a chlamydia or gonorrhea test declined by 11% in Australia. 3. Travel pretty much came to a halt. This means less movement of cases of STIs in and out of and around Australia. So, the pandemic has likely had a mixed impact. It has led to reductions in the number of cases that are being detected nationally. However, it's also led to reductions in testing. The decreases we did see weren't necessarily experienced equally though. For example, gonorrhea didn't decrease in remote areas or among Aboriginal and Torres Strait Islander peoples. This may relate to differences in COVID restrictions across Australia in 2020. So Australia, in some settings you've been testing positive more often for some STIs, and some you've either had fewer cases of or you just haven't been getting tested for them as much. Like I said, it's complicated. So what do we do with a complex STI report card like this? Well, we can't assume that just because cases have decreased, they're no longer a problem. We need to sustain and enhance access to appropriate prevention and treatment to ensure all populations can access the care they need to stay healthy. The other thing we can do to improve Australia's chances of eliminating STIs is normalise sexual health. So if you're lucky enough to be getting lucky, now that COVID restrictions have eased, there are some things you can do. Use condoms. Talk to sexual partners about sexual health and get tested for STIs and bloodborne viruses. Yes, Australia, I mean all of them. It's free, it's easy, and it's pretty pain-free. Pee in a jar or give a quick blood sample. There's no shame in having an STI or bloodborne virus. So let's have open discussions about it to make sex not just fun, but safe. The best part is then you can get back amongst it, reassured that you're engaging in safe sex with whoever consensually takes your fancy. And remember, I'll be watching. Not really, but I will be looking at the data to help fight the good fight against STIs.